Hi friends. After 5 minutes from now you should be able to manage any asthma case that will come to your clinic. Okay? Let's go. Good morning. In this video, we are going to discuss how to make treatment plan for asthmatic patient in your clinic professionally based on recent 2019 guidelines and algorithms. But before starting, I would like you to memorize 2 simple rules. Rule number 1. Day is short. By night you should be sleeping. How is your function? Rule number 2. Normal FEV1 is greater than 80%. Normal FEV1/FVC ratio is greater than 85%. Now let's start. You all know that we should assess asthma severity before starting treatment. An assessment depends mainly on 5 parameters. Daytime symptoms, night awakening, frequency of beta agonist use as treatment not as prevention, for example, exercise-induced asthma, interference with daily activity, and finally lung function results. We are going to follow that, in simpler way. Starting with rule of days short, that contain 2 parameters. Daytime symptoms, and use of short-acting beta agonist frequency. Both parameters are identically the same values and references in every severity degree. By night you should be sleeping, is one parameter that correspond to night awakening. How is your function? Correspond to both daily activity and lung function, which are also pretty much identical in every severity degree. So every patient will be asked 5 questions. How many times per week are you complaining from asthma attack? And how many times per week are you using short-acting beta agonist? And that will cover days short. How many times do you awaken from sleep at night because of asthma attack per month? Please note, per month not per week. And that will cover, you should be sleeping by night. And finally, ask for how the asthma interferes with his daily activity, then ask for pulmonary function tests. And that will cover how is your function when to diagnose intermittent asthma, and what to do then? Intermittent asthma is characterized by the following. Patient is getting asthma attack and subsequently using beta agonist once or maximum twice per week. Awaken from sleep once or maximum twice per month. No interference with daily activity and has normal pulmonary function tests. For that, we prescribe for him beta agonist inhaler or nebulizer on PRN basis. In mild persistent asthma, patient will have more than 2 attacks per week during the day and subsequently will use beta agonist in same frequency. He also will be awakened from sleep more than 2 times per month at night, means 3 to 4 times. Means nearly once a week. Patient will have minor limitation on daily activity. Pulmonary function tests will be normal or mildly decreased. For that we will need to add 1 of 2 medications to the PRN beta agonist. Either low-dose inhaled corticosteroids or leukotriene receptor antagonists. In case of moderate persistent asthma, patient will suffer from daily attack and of course will use beta agonist daily. He will be awakened from sleep more than once a week. Patient will suffer from moderate limitations of daily activity and also moderate decrease in pulmonary function tests. FEV1 will be 60 to 80%. For that, we have 3 options. Either to add low-dose inhaled corticosteroids if leukotriene receptor antagonists was used in the previous step or vice versa. Second option is to increase inhaled corticosteroids to medium dose. Or to add long-acting beta agonist. In case of severe persistent asthma, patient will suffer from attacks throughout the day and awaken from sleep almost every night, with extreme activity limitations and FEV1 will be less than 60%. For that, we should shift the patient to high-dose inhaled corticosteroids or even consider using oral form. Also we should think about omalizumab, especially if patient is suffering from allergy. But in any way, we should refer the patient to asthma specialist. Remember, before stepping up treatment, first check adherence to environmental control and in other comorbid conditions. Second important note. In case of patient less than 4 years old, if no response to treatment appreciated in 4 to 6 weeks, please consider other diagnosis and stop treatment.